I'm Dr. Lisa Kunze. I'm a board-certified anesthesiologist, and I'm the director of orthopedic anesthesia here at the Beth Israel Deaconess Medical Center. I understand that making the decision to have surgery can be stressful, and I want to reassure you that our whole team is here to make sure that the surgical and anesthesia experiences are as positive as they can be. The anesthesia for your surgery is important, so I'm going to review a variety of options for anesthesia and pain management for your joint replacement. The ultimate choice for the type of anesthesia you get is going to depend on what is best for you. For joint replacement surgery, the options are either general anesthesia or spinal anesthesia. We will provide sedation with the spinal anesthesia so that you can comfortably rest during the procedure. In either case, you will be comfortable during the surgery. If you are having a knee replacement surgery, we usually perform a nerve block on your leg prior to going into the operating room. This procedure helps to decrease the amount of pain that you will experience after surgery. The nerve block is performed before you go into the operating room, and you will be mildly sedated for this procedure. A few comments about pain. Having a joint replacement will help you to have less pain in the future, but you should expect to have some pain following your surgery. Our goal is to minimize the amount of pain that you will experience. We will use nerve blocks and a variety of medications to achieve this goal. You will have some pain, but we will help to make it tolerable. All of our patients having a joint replacement are evaluated in the pre-admission testing clinic. In fact, some of you may have been there already. During this visit, your overall medical condition will be carefully evaluated by one of our perioperative nurse practitioners. They will carefully review your medical history and explain which medications you should take on the day of your surgery. If you have further questions about the type of anesthesia you will be getting, please ask to speak with the anesthesiologist who is in the clinic that day. You will meet the anesthesia team selected to take care of you on the day of your surgery. They will have received information about you in advance and will have developed an anesthesia plan specifically for you. We are looking forward to taking care of you during your surgery.